Lewy body dementia is one of the syndromes that we are very focused on. It's probably the second most common cause of dementia in the United States behind Alzheimer's disease. And it's a disorder in which patients look like they have Parkinson's disease, in some aspects look like they have Alzheimer's disease, but it's actually a combination of dementia and movement disorder. And the nomenclature, the naming is a little bit confusing. There's the umbrella term is Lewy body dementia. Lewy body refers to the pathologic findings in the brain of an abnormal misfolded protein that is spherical, and it's called a Lewy body. There's also what they call Lewy neurites, which are straighter forms, but they both have the abnormal protein called alpha-synuclein. Okay. Now, under the umbrella of Lewy body dementia, we have Parkinson's disease dementia. About 40% or so of people with Parkinson's disease will develop problems with thinking and memory, okay, as the disease progresses. So that's Parkinson's disease dementia. In that group, the Parkinson's disease begins first. In other words, the movement disorder, the tremor, the stiffness, the unsteadiness of walking, the slowness. And then after at least a year, then patients can start developing some problems with their thinking, with their memory, concentration, and that's the Parkinson's disease dementia. The other group under the Lewy body dementia is what we term dementia with Lewy bodies. And what that disorder is, patients look like they have Parkinson's disease, but the problems with memory and thinking begin earlier than they would with Parkinson's disease dementia. It gets very confusing. And the differences in the two also, people who have dementia with Lewy bodies have very prominent visual hallucinations very, very early in the disorder. And sometimes occasionally they can present with that. And then down the road start developing some more cognitive problems and develop the movement disorder. Okay? Now both dementia with Lewy bodies and Parkinson's disease dementia are the same exact pathology, the Lewy bodies. However, they're in different areas of the brain. And that's why they affect the patients differently depending on where the Lewy bodies are in the brain. It's very difficult, especially early. It's estimated about 25% of people who have dementia with Lewy bodies are not diagnosed initially. And I can tell you from personal experience, I've had several patients, when I first see them, I think, oh, maybe this person does have probable Alzheimer's disease. And then I'll see another patient, I'll say, maybe this patient does have Parkinson's disease. But as patients are followed longitudinally, it becomes obvious they have dementia with Lewy bodies. It's a very underdiagnosed disorder, and therefore I think not a lot of attention has been paid to treating it specifically. There's a lot of attention for Parkinson's disease, a lot of attention for Alzheimer's disease, but dementia with Lewy bodies is kind of lost in that.